Assalamu alaikum wa rahmatullahi wa barakatuhu. In the name of Allah, the most beneficent, the most merciful, the most gracious. Brothers and sisters, welcome to a new series with Children of Adam, specifically discussing mental health. And of course, a topic that is so important within our community, affecting all parts of our lives, larger community that we are living in. So, inshallah, in this new series that we are starting, we will be joined with special guests, experts in the field, who will speak to us with regards to mental health, substance abuse, awareness regarding these, important topics, and also, Islamic perspectives of what are some of our steps that we can to take as families, as individuals, as people, parents, brothers and sisters, to help and support one another in this particular situation. With that being said, tonight's topic itself in our conversation tonight is mental health and substance abuse awareness. Tonight, our guest is a very special and honorable guest. He's Merritt Hartley. He is a therapist, a social worker, a chemical dependency counselor. Merritt provides counseling for individuals and families struggling with substance abuse and addiction issues. He's also a lecturer at the OTI, which is the Outreach Training Institute, the largest program training in New York State itself, has trained more than 3,000 individuals and counselors since 1997. So he's an expert in the field. Merritt also works closely with high school and college students and lectures several times around different universities as well. He is also an alumni athlete for Division I University. He's uniquely qualified to work with college students who are struggling with pressure and stressors of college life. And he's also on the advisory board for Drug Free Long Island and provides talk on suicide prevention and intervention. With that being said, our special guest for tonight, Merritt.
Um,
Welcome.
Welcome, Mufti Farhan. How are you? Thank you for having me.
I am so grateful for having you, and thank you so much for being with us this evening.
Yeah, it's my pleasure. When I first met, Hamza, I guess several years ago, we started having conversations about addiction and substance abuse and mental health and how it pertains to the Muslim community. Because I always felt that there were certain communities and populations that weren't getting the help they needed, because of the stigma that exists, because people don't believe that drug abuse and mental health, is a disease. They believe that it's a matter of willpower. Why can't you just change? But, Mufti, you can't. You can. It's a disease of the brain and you need to address it. So I'm hoping that through these series of talks that you'll have and moving into the future, we can help the Muslim community understand that it's okay to ask for help, you know?
That is so important. That is so important. Let's jump directly to our questions and some of the conversation that we really want to have with you, because I know
Okay.
many people who are joined in are also fasting, and within 40 to 50 minutes, they will be breaking fast as well. So,
Right.
one of the important questions that comes to mind is that when we talk about substance abuse, um, how is substance abuse connected to mental health? I mean,
Okay.
is there any connection between the two? Do they go hand to hand? Are there two different things? So how could that just be related so that we at least get into the basics of the topic?
Okay. So, in my experience over the last, maybe 15 years in working in this field, I believe that one doesn't exist without the other. I have found that 90% more of people that struggle with a substance abuse issue also have a mental health issue. And people that struggle with mental health, 9 times out of 10, are struggling with substance abuse because if they're struggling, for example, with anxiety or depression, and it's not being managed by a doctor, what do? They self medicate. So they take drugs to try to ease the anxiety, to ease the depression. And on the flip side, if you have somebody who's struggling with addiction, let's say whatever it is, alcohol, a drug is a drug, so whether it's alcohol or heroin or cocaine or marijuana, at the end of the day, they pretty much have I want to say, hijacked part of their brain because of the drug use. So now they're drinking as an alcoholic, and alcohol is a depressant. So now they're becoming more depressed. So, sometimes what came first, the chicken or the egg? Did the depression come because of the drinking, or did the drinking become because of the depression? So, to answer your question without getting too deeply right now, they both kind of coexist. And that's why they both have to be treated at the same time. Back in the early 70s, treatment centers, if you had an alcohol problem, you came in to be treated for alcohol. If you had depression also, they kind of put the depression up on the shelf and say, we'll deal with that later. But you can't do that because now you stop drinking, but now you go back out and your depression kicks in. So it's a vicious cycle and you start drinking again. So they really have to be treated at the same time.
That's very, very important. Thank you so much for that. So, one question that usually comes, and of course, as imams, as clergy and leadership, I think it's very important for the clergy themselves to also be involved and also learned about, what is mental health and what is substance abuse. And because a lot of time it is considered to be a safe space, and so many youngsters and people are able to come in and speak to imams. What do you recommend the clergy or the leadership in way that they could do to take that first step to at least become like maybe first responders, or of course may not be able to directly help someone, but what could be some of the steps that the clergy or the leadership could learn in order to help and assist their community when it comes to mental health and substance abuse?
Well, I think ideally, the way to deal that is for somebody like myself to sit down with a group of leadership and really give them, education, prevention, and intervention. And really, it doesn't take a lot to really go through, an education on the basics behind drug addiction, help them understand how it's affected, and then talk to them about ways to recognize issues and help them be able to, talk to people in a fashion where they're in a safe place. And then, of course, working with somebody like myself, hand in hand, we can address the issue.
I think this is amazing. What you mentioned was those three words. If you can kindly elaborate just for a few moments on those. You said education, uh,
Prevention.
prevention, and intervention.
Yeah, so I think that, the biggest problem that we have in society right now is that the reason a stigma exists is because of a lack of education. You know, I work with a lot of families, parents like, why can't my son just stop shooting heroin? Why can't my
Mara, did we lose you?
there we go. Are we back?
Yes, you're right.
Example, let's say if you had a family member that had cancer, you wouldn't throw them out of the house if they weren't taking their chemo. You'd want to learn about the disease, right? If they
Yeah.
had diabetes, you want to learn about the disease. So the more we can help educate people, I mean, I'm talking about middle school, the more that we can educate families and clergy about the disease of addiction, then they can understand. So it's about education. It's about how to prevent people from becoming addicted. But once they are addicted, how do you intervene? What are the interventions that you can use to get them into sobriety or help them with their mental health?
Hmm. So the key three things are education, prevention, and intervention. That's amazing.
Yeah.
So you mentioned that the education or the process starts at a very early age. Being an expert and person who's been in the field for decades now, have you seen a rise at the age where it's much earlier in the age that children are becoming used to substance abuse or mental health issues that are connected together in our communities?
Well, I'll tell you what, it's very interesting you bring that question up. I'm sure you're familiar with how bad the fentanyl crisis is now, correct?
Correct, correct.
So, and I've been a big advocate for that. I have a weekly podcast called Recovery Road. And for the past 2 years, I had brought family members on to talk about how their children had been dying from fentanyl murder, from poisoning. And, the first mom I had on, Amanda Faith, it was during COVID. And, the children were home from school. And her son, Luca, was on Snapchat, 13 years old, bought a Vicodin from somebody on Snapchat and died. So I think that we have to really now, there are things happening across the country now where education is being brought into the school. I believe that a child is, if they're learning about math and about history and about science, they should be learning about addiction through health class, because children need to know. Because several months ago, 3 14-year-old kids died in Connecticut from vaping cannabis that was laced with fentanyl.
Wow.
So in 2022, there was about 120,000 people that died in this country from fentanyl poisoning. But what happens is, again, Mufti, it's communities in denial. It's people in denial. They don't want to believe that there's a problem. For example, I called up I belong to a couple of organizations. We had a big rally last year down in New York City at Foley Square to bring awareness to fentanyl. I had moms come with pictures of the kids that died. I sent an email to Mayor Adams asking him to please come and be a speaker. He refused to come. He was too busy. He said that he wanted, I got a message back from the mayor's office, wanted me to meet with the New York City Department of Health and Hygiene. And I wanted to meet with them. And I had a whole meeting set up and they kind of backed off because I don't think people want to address it. I think that my goal was to meet with the Board of Education for the city of New York and then the Board of Education for Nassau and Suffolk County and talk about making addiction and mental health a course curriculum in schools throughout the region,
Correct.
but it's it's a problem because people, it's like the big elephant in the room, Mufti, nobody wants to talk about
Yes. Do you feel that the whole "not my child" mentality
it. Yes.
exists?
Oh, I've had so many parents that I would go to and say, please let me talk to you. Let me come into your community and talk about, for example, a couple of years ago, my sister lives out in East Long Island, and she had asked me to come in and start a family awareness program in their community. And I came in once every couple of weeks. This is a community of 6,000 families, big high school, middle schools, and I came in once every couple of weeks, and I brought in guest speakers, and we talked about education, how to talk to children about drug addiction, to help make families become aware. Right now, you would think that I would have hundreds of people in there. I think the first week I had maybe 30 people, and I couldn't get anybody because the message in the community was, if you walk into that building where they're having these talks, you must have a drug problem. So it was like a community in denial. So I had moms come to me and say, what can I do? That can't happen to my child. That can't. But you know what? I couldn't get 25 people to come listen to me speak. But the next day, there were 1,500 people online at the funeral home for the 15-year-old kid who died from a heroin overdose. So you tell me, we have a real battle on our hands, but I think it's a necessity. We have to keep pushing. We have to get the message out.
Thank you so much. This is amazing. I'm going to run through some of the questions that were sent to us with regards to this program, and I want to get some of your expert opinions on it. One of the questions that one person asked is that I want to begin a conversation in regards to getting help, but don't know who to turn to. I'm afraid of being judged by imams and leaders and community. So for that, what's the first step? Meaning, if there's someone who has enough desire now to change their lives, and I know this is the month of Ramadan for many people, they want to change, they want to reflect over their own lives. What's the first step? Meaning, how do they start getting help?
Call me.
Great.
I mean, I'm telling you, at the end of the day, I work with people all across the country, and I have no problem with putting out my phone number. I'd be more than happy for people to call me. What do I do? Where do I go for help? Because I think that, my goal, hopefully with you, is that we're going to be working on this for a long time to come. And we're going to build models and places where Muslims can come and get help. But in the interim, you have to be careful who you speak to. You can't get the wrong information about where to go. So I would be more than happy to have you.
Merit, I think we lost you.
Oh, no.
Yes, we're back. So a quick question. Of course, thank you so much. And of course, we're going to create a system where we can have our audience and our brothers and sisters and parents, whoever it is, be able to get in touch with you and schedule, programs and meetings and calls with you. Is there any specific number, or is there any specific organization or people? And of course, as children of Adam, we are trying our best to create an in-house space, a place where we will have, counselors and professional like Merit and other who are, academics in their field, to be present with children of Adam on ground to be able to provide support. But is there anything now where you feel that it could be something very quick? If someone, so do you think that we can maybe after program share your email or something where people
Yes,
can
my email, my phone number, they
good.
can get me, Twitter, Facebook, Instagram. I'll be
Got it.
more than happy anybody that I can.
Thank you so much. Second question is from a parent. A parent asked, my son is suffering with addiction and I want to get him help, but I don't know how to convince him, nor do I have any family members or friends I feel comfortable enough could discuss with this. What's the best approach?
Well, and here's a tricky question. It really depends on how old the child is, because if the child is 18, or if the child's an adult, you can't force them to go into treatment. But I think ideally it means hopefully letting the kid at least open up to being able to talk to somebody, like myself, that can come in, talk to the parents about how to talk to the children. Or, I seem to have, I love working with adolescents. So if we're looking about a quick fix, Mufti, it means, let them really reach out to me, and I can arrange something. I can meet with the parent, I can meet with the family. I've got associates that work with me that I can do that as well, and embrace this. My thing is that if somebody calls you today, Mufti, and they want somebody to help, we need to jump on it right away, because the window can shut real fast and then nothing happens, right?
Yes, that's my biggest concern as well, is that that window is too close and it shuts too closely, and even in anything in life where you want to change, you want to do something good, and it's just that moment. If you don't utilize that moment, it's gone. So that's important. So, any specific tips that you would give parents to have a conversation with their children who are going through addiction and not ready to ask for help or seek help? What conversation can parents have with children to get them towards looking for help?
I think it's a very sensitive issue, but I think parents, these days kids are probably scared to talk to their parents. They don't think their parents are available. But I think the biggest problem is having healthy communications. I think the parents should be sitting down with their kids and maybe not singling them out, but saying, it's important that we have a conversation about the dangers of addiction. I'm not judging you, and I'm not picking you out, but I've seen a lot of children out there now that are struggling uh, with depression or anxiety. They don't know who to come and talk to. And as your parent, I want to help you. I want to help you. I'll find somebody if you don't want to talk to me. I'll find somebody for you to sit down with, because I really want you to understand about the dangers out there. It's not about you, but right now, Mufti, fentanyl is being laced in everything. So a
Yeah.
kid might be friends innocently enough, smoking a joint, and they're dead. So I think a parent has to say to their kids, and I encourage families that I work with all the time, sit down with your family and say, I just want to have a talk with you about addiction and the dangers of drug addiction. And then to talk about, it's important to talk as a child, to be able to talk to their parents about how they're feeling without being judged, right? Without being punished. Parents need to open up those healthy lines of communications. And it's also about, if the child is talking, there's a big difference between listening and hearing. So just don't hear what the child says. Listen to what the child is saying and really understand them, and don't judge them. Don't challenge them. Say, you know what? If you're not comfortable talking to me, then I'll find somebody you're comfortable talking to, because I really just want you to get the help you need. I'm not saying you're bad. I'm not saying you're good. I just want you to get help so you can become a healthier, happier person.
That is so important. That is so important. And the key words as not just, listen, but hear them, not, and not just, hear their words, but to truly listen and to really ponder and reflect over their words. And this is so, so precious. And that's why our next steps through Children of Adam's mental health initiative is to create maybe a hotline or a direct access program where families and individuals can anonymously call, ask for help, ask for assistance, and be connected, because we're beginning to see that this is affecting our community. It's affecting our children. The third question that's come is that from a person who has tried seeking help and they're still looking for more help. They said that I have tried outpatient rehab before, but counselors and fellow patients do not understand my circumstances as Muslim and having immigrant parents. What resources are available for a person in my situation? So, with regards to circumstance as a Muslim, I can touch upon that. But
Yeah.
as having immigrant parents, what resources are available for a person in that situation? So, a person tried outpatient rehab, but counselors and fellow patients do not understand the circumstances that that person has immigrant parents, so it's causing them a lot of issues. So
You
at a
know,
larger.
Yeah, I can tell you, at the outpatient facility where I work, the staff that works there are all trained in cultural competency. And it's all about understanding different cultures and different populations. And I think that when somebody comes in to a group environment, they're welcomed. I don't care whether you're Muslim or African American or Jewish or whatever. The idea is that they need to feel safe. So in that case, my answer would be to talk to somebody like me or us as a group and to make suggestions to them as what's going to work best.
Mm, understood.
Margin, right? Because they feel marginalized. Immigrant parents, just because they're immigrant parents doesn't mean that they're not understanding and want to learn more. So it means maybe meeting with the parents, maybe
Right.
having open forums, having, city hall meetings where we invite the parents to come and we sit down with them and we talk to them so that they feel better about addressing the issue.
I think that's the big thing is that there's never been conversations like this. And I think
No.
it's always been a taboo and stuff, and no one discusses this. And I think having that conversation is very important. The next question is that I know I need help and I'm willing to get it, but my family will not be happy with the news. And I know that I will get kicked out of my home. How do I discuss this with people who are closest to me? Because as we live in a society which is so judgmental, right? And for so many parents, their children are their scorecards. They rather have them suffer rather than let anyone know that they're going through a difficulty. And that's the society that we're living in. We're living at a time, and I remember having a conversation with you, is it better for you to take your child for help, or rather than carrying their coffins and their bodies, because you're
Yeah.
going to lose them very soon. So the question is that I need help and I'm willing to get help, but I know that my family will not be happy with this news, and I know that I'll get kicked out of my home. How do I discuss this with people who are the closest to me?
Well, you know what? I think when it comes down to it, Mufti, we're talking about life and death. And I think what's going to happen, this is probably going to be baby steps, but there's going to have to be a change in how this whole Muslim viewpoint is. If a child really wants help and they're prepared to do whatever it takes, I can find them a facility to go to and I can get them moved out of their house and into a facility to live where adolescents their age live and just get them out of their environment altogether. The question is, I think this is going to be some hard conversations to have. I would love to sit down with some Muslim parents and really say, so you're telling me that your child needs help and I can give them all the help they want. But if they accept this help, you're going to throw them out of the house and you'd rather see them die than get the help. I mean, that's an amazing conflict that we have to be able to change.
Yes, yes.
But if the child really wants to help, we can find them help. And then they have to make a decision. To what extent are they willing to go to get help? And if they're willing to go all the way, there's sober houses, there's houses for teenagers where they can go and live and get the help that they need all over New York.
But I think there's a shift of understanding that needs to be created, because at the end of the day, the parents, truly are passionate, they're compassionate, they love their children, they care for them, and they hope the best for their children. And I think it's just a misunderstanding in their minds, the concept itself. And I really like the question, the statement that you mentioned earlier, where if God forbid, if your child is going through a cancer or something, are you going to not have them have chemo? Just
Yeah.
because people will say that your child has cancer, meaning will you let your child die and not have services like that just because people may say, oh, you have cancer in your family? So I think it's important for families and individuals, and especially adults and parents, to realize that it's okay to seek assistance. It's okay to seek help and take your children to facilities and places which will be able to provide them help, rather than losing your children altogether. And you must have this in front of you, right? You must see a lot of people pass away. You must see people die because of drug abuse
I
and
have.
things like that.
I've seen, families throw their kids out on the street. And, if a kid is an addict and he gets tossed into the street by the only people that he knows loves him, a lot of these kids wind up overdosing because they just have no will to live. But I think we need one family to stand up and say, I want my kid to live. I want to save my child. And somebody's have to stand up, and then maybe it'll be like the domino effect. And maybe slowly over time, other families will fall and say, oh my God, why have I done this to my child? I mean, listen, Mufti, I'm not really familiar with with the whole faith, but is that against Muslim faith to
Not
not
at
take?
all. Not at all. It's just cultural issues that has, this is a toxic mentality in the minds of people, where, just to keep that superficial honor and dignity of saying that we're perfect, there's nothing wrong with us, there's nothing wrong with our families and our children. And I say this to parents as well, and even couples. Like, if they need help, go seek help. Ask someone for help. There's never a perfect family. Sometimes there's ups and downs when it comes to children. Speak to someone, find resources that are reliable, and it's okay to seek assistance. And I think not asking for help, not getting engaged, not having conversation is truly affecting the cores and the depth and foundations of our community.
Yeah, and I think the whole family unit has broken down. There's no communications, healthy communications. Um, are you familiar with Alcoholics Anonymous as an organization?
I ever since I spoke to you and I heard about this, this is something that I wish that as us Muslim community can do, and this is my dream for children of Adam to actually create something like that. Would you please
Yeah.
elaborate a little bit upon it so our community can learn about this important work itself?
Well, and I'm going to do this with you. We're going to, part of the work that we're going to do, we're going to create a program it's based on the principles of Alcoholics Anonymous. I like to call it People's Anonymous. It's a place where people can go once a week or several times a week to talk about their lives and not be judged. If you look at the 12 steps of AA, it's really not about not drinking or not drugging. It's about how to live an honest, wholesome life and not live with any secrets or resentments or hatred inside. Because Mufti, how many people do you know take resentments and hatred to the grave?
Oh, oh yes,
Right? So
yeah.
part of the program is to be able to really go through the work and to take all those skeletons out of the closet, get everything out, deal with it, and move on. Because you can't have peace of mind if you're carrying around skeletons in the closet.
It reminds me of the saying of the Prophet, peace be upon him, Prophet Muhammad in Islam, where he said that from amongst the people of paradise are those who have a clean heart, meaning they don't
Yeah,
keep those feelings in their heart, resentments and ill feelings. And he saw an individual walk in the mosque, not well known to any individual, and he said, a person of paradise will walk inside. People said, who is this person? And after 3 days of continuously searching about his life, they figured out that this is a man who has the most cleanest of everyone's heart, meaning does not keep any feelings for others. So having a clean heart is so important. So going back to the word NA and AA, you said it's a program called Alcohol Anonymous and Narcotic Anonymous, where
right,
a support is provided for a group where there's conversation and slowly a place and space is provided for them that they are able to let go of these addictions in their lives. And I think this
right.
is so important, so amazing to really start this program within, in our community and of course within the larger community as well.
Yeah.
Next question is: while battling addiction and relapsing from time to time, I find myself, praying while high because sometimes that's the only hope I have. And I'll because it's more of an Islamic question, so I'll take this. Will my
Okay.
ibadah, my worship, still be accepted, or is it a waste of time, like everyone says it was? So Allah, the Almighty, our God, is most gracious and most generous. The one who allows you to turn towards Him, even though you may be high at that time. And of course, I'm not saying intoxicated where you don't know what you are saying, where you completely lose the mind of saying what you're saying, as the Quran says to step away from prayer till you don't, realize your mental stability. But being at a person who is high or at this particular state of using certain drugs, if Allah the Almighty has allowed you to raise hands and bow down and put your head to the ground, that means He loves you. He cares for you. He allows you to open that door. And there's no one who cares for us and loves us more than our Creator. Certain people in this world who love us unconditionally. Amongst them are people like our parents, and that's why our mothers are those that the Quran or the sayings of the Prophet gives us the example that the Almighty loves you 70 times more than your mothers. And 70 is just a figure, it means unlimited amount. And giving the example of a mother is because her love is unconditional. No matter what you do, at the end, she'll sit at the door waiting for you, even though you were wrong. She's still
Right.
waiting for you, crying, and for you to come back and accept you with all of your faults.
Of
Allah
course.
loves us more than 70 times our own mother. So, how is it possible that if I may be involved in something wrong and I want to change and Allah will not accept? Doesn't matter. We fill the heavens and earth with our sins. Come to Allah the Almighty, the Lord, with forgiveness and with true sincere repentance, all of your sins will be forgiven. A man, Umar bin Khattab, a man who picked up a sword to assassinate the Prophet, peace be upon him, a man who people said will become, animals can accept, but this man will never change his life, became such a precious person that the Prophet said, if there was a prophet after me, it would have been you. So people could change.
Right.
Anyone could change.
Oh,
It's the will and desire. So never give up when it comes to that. Another thing is, let me, okay. So what else? And then we're coming closer to the mark of our half an hour. But I wanted to get your some of your thoughts on this. Sorry.
well, you bring up a good point, and I think at the end of the day, listen, there's hundreds of man-made religions, right? And everybody does pray their own special God, but there's also spirituality, and that's in the soul. And people have to find the connection to their God through their soul. You know, I don't think you don't have to be in a temple or a mosque or a synagogue to find that. You can find that wherever you're sitting, right, wherever you are. And I think people have to just realize, like you said, God, Allah, they're not punishing gods. They're loving and caring gods. And I think that people, although brought up with a fear, or the fear of God, that laws are punishing, but they're not. So I think people have to be willing to, here's my thing. You have to surrender totally, to give up your soul, surrender your life to a higher power, to know that you have to turn fear into faith, that you'll be taken care of if you give completely 100% up, if you surrender.
Wow, amazing. Fear to faith. Wow. That's
Fear to faith.
amazing. Fear to faith. That is so important for all of us to really take back. We have a comment from Brother Ziauddin. Assalamu alaikum. Thank you for bringing this to a spotlight. Much needed in our community, most definitely. And this is just the beginning of many other programs that we're hoping to have. As we're coming to the conclusion of our program, Mary, thank you so much for your time and for your generosity, for being with us, and your wisdom. What are some of the next practical steps that you feel that uh, we can take as a community?
Okay.
As it might be a very infinite stage for us. The immigrant community, it's been here for a while. We have people from 60s and 70s here, but this is the first time that the second and third generation is growing up at a community where it's a melting pot, and things
Right.
that are affecting the larger community is also affecting the minority community, or the South
Right.
Asian community, or Muslim community, or you just name it, any community that's being affected. So what are some of the crucial steps that you feel, through your experience in so many years with regards to being a counselor in substance abuse, that we take for both parents and for both children? What
You know,
are some of the key steps?
I think that doing these talks that we'll hopefully be doing every couple of weeks and bringing awareness. I think we need to do is find a place, find a community center, some place that's available, and put the message out that on this date at this time we are going to be having an open house conversation. We invite all parents and families to come and talk openly about mental health and substance abuse, and we'll be able to answer all the questions you have. There'll be resources available for people that want to take it a step further. But let's get some people in a room, Mufti, let's get some people in a room.
Yes.
I think once people hear that, they're going to say, oh, did you hear about that meeting last week? We need to go next time.
And Mary, if I please stop you for a second, for parents, please don't worry about being judged when you are joining these meetings or you're coming to these programs. It may not be directly benefiting you now because your children may be perfect. That's fine. And may Allah always keep them in good health and in good condition. But you may become a source of goodness for someone else. You may take back sources that may help someone else. And even if you're in need, it's okay. When we walk inside a doctor's house, doctor's office, I don't feel ashamed that, what people say, that I'm sick. It's okay, because it's for my own self, right? We have lived our lives enough thinking about what other things think of us. Now we
Yeah.
have to start living our own lives and thinking of what my connection with the Almighty is. So that stereotype, that taboo that is existing in our communities, please, we need to remove that, brothers and sisters. Allah is Kareem, Allah is generous, Allah is forgiving, Allah is merciful. He provides us all of these resources to change and come back towards Him. And I love the idea of gathering the people together. We have many institutions within Long Island that has more than sufficient places. So we'll definitely plan something soon as Ramadan is coming to the end. I think before summer starts, we should definitely have one large in-house presentation on substance abuse and mental health for the larger community in-house, so parents can come in, children can come in, they can ask questions, they can be inshallah taught, and they can be given this information.
I wanted to share one thing just with the
Please.
audience that's watching. I'm saying this. So in September, I'll have 15 years of sobriety. So I've walked the walk. I know where people come from. I wrote a book that came out 2 years ago, became a #1 bestseller. It's called Lost Innocence, My Journey from Addiction to Recovery. You can find it on Amazon.com. You can go to my Instagram, Merit Heartblade page to a link to the audiobook. So I want to do whatever I can. I believe that, I'm one of God's prophets. He sends who I need to help. And I think what we're doing together, this could be eye-opening on a global basis. We start on a small level like this, Mufti. I think we can.
Just for our Muslim audience who are present there, prophet does not mean a messenger who has come in with
Oh,
revelation. We just want to make sure that clears out, as our faith itself defines Prophet Muhammad to be the final prophet. But of course, a person on the face of this earth who brings the right message to people. We're all, individuals and people who have been sent as Khalifa, successors on the face of this earth to take the message. As the Quran mentions, "Inni ja'ilun fil ardi khalifa," that I'm creating insan as a human being, as a vicegerent, as a khalifa, as an individual to go and take the message of righteousness towards others. But I do appreciate that, and that's amazing. For 15 years, we need to learn a lot from your experiences. Share that with the community. It's not
yeah.
easy, of course, it's challenging as well, but continuously making the effort. And I always feel that when you have the will and the desire, you can reach anything. You can accomplish anything, and that is truly, truly amazing. Any parting words from you before we conclude? Thank you so much for your time today.
I just think that who's ever watching this tonight needs to really take this to heart, to say that it's better to save a child, to help a child, and not care about what somebody says about you as a parent. And I think if we work together, I think that all it takes is one family, one child, one mom, one mother, one father to come together. And once we start that, I believe that we can change. We can change a community. It takes, it takes a village, right? It takes just a few of us to hopefully change a whole community.
Thank you, Barrett, for your time. Let's go over some of the key words that you mentioned: education, prevention,
Prevention.
intervention. These are our three key factors. We also learned faith over fear. And these are
Yeah.
some key factors that we should remember from this conversation. And we ask Allah the Almighty to bless us with this beautiful endeavor that has started. This is our next step in Children of Adam, to create an entire platform with mental health and substance abuse awareness. We'll have many more of these live events over the course of the next few months. We'll have an in-person events as well. And we're trying our best to create a space within the Center of Excellence, which is the headquarters of Children of Adam in Long Island, to create a space that will allow our families, our youngsters, our youth to come into the place in person to seek assistance and help from both religious and counselors and medical professionals who will be able to assist them in this journey of mental health and substance abuse. Again, Merritt, we want to thank you for your time,
Yeah,
for
my
your
pleasure.
wisdom, and for your knowledge. And we hope to see you very, very soon. Thank you so much, brothers and sisters. And please, this is the month of Ramadan. Keep us all in your prayers. This is the last Ashra, the last 10 days, some of the most blessed nights and days during the course of the year. We hope that Ramadan is going well. May Allah accept your fast, your sadaqah, your charity, your prayers, and your fastings. Please keep me and the entire Ummah in your dua. Assalamu alaikum wa rahmatullahi wa barakatuh.